بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. My topic today is about bariatric surgery primer. I will discuss here the most common and less common procedures in the bariatric surgery, and in the following talks I will discuss each of them alone with uh, speciality and see the complication of each procedures. Introduction: obesity is increasing globally, and bariatric surgery it is overall reduce the mortality on obese patients, and it is associated with beneficial effect on diabetes and cardiovascular disease. Bariatric surgery procedures have been evolved over the past 50 years, and we have two procedures, either restrictive in volume or malabsorption, and the restrictive like sleeve operation, and in malabsorption like oxon RY operation. And also in RY operation it is a restrictive type. Here we have the common bariatric procedures: laparoscopic adjustable gastric band, gastric sleeve, and Oxen Y gastric bypass. A laparoscopic adjustable gastric band, there is inflatable synthetic band from silicone placed just below the gastroesophageal junction. It is a form of restrictive surgery with a small gastric pouch forms over time above the band. Here we see the pouch above the band. Here this is the band, and this is the pouch above the band, and here this is the esophagus, and this is the access port to adjust the band. And it is a restrictive type of surgery. Here, this is an X-ray with gastric band, and this is the port, and this is the tube, and normal in position. Oxen Y gastric bypass. It is the commonest bariatric procedure performed. It combines the restrictive effect by creation of a small 15 to 30 ml gastric pouch from the proximal stomach, and malabsorptive effect by bringing up a rox lobe and anastomosing it, usually side-to-side anastomosis to the gastric pouch. A jejunostomy is creative, approximately about 100 to 150 centimeter distal from gastrojejunostomy. Bypassing the segment of a small bowel gives rise the patient less ability to absorb the nutrient, and which helps with weight loss. Any visible defect in the mesentery also will be closed. Here we see the small pouch of gastric, and there is gastrojejunostomy, and this is the Roxham loop. It is with distal anastomosis with jejunostomy. And here, this is the gastric pouch, and this is the gastrojejunostomy. Sleeve gastrectomy. It is gastric tube or sleeve of a reduced capacity of the stomach to about 100 ml, created along the lesser curvature by stapling along the length of the stomach. The excluded stomach and the greater curvature are removed. This procedure, the this procedure reduced the size of the stomach by about 75%, and it is a restrictive and has a restrictive effect. And we see here this is the gastric tube along the lesser curvature, and this is the stapler, and this part of the stomach it is resected and removed, and normal passage. And this is a restrictive type of gastric surgery. Here, this is the gastric tube, looks banana in shape, and you see the normal passage from the pylorus to the duodenum to the small bowel in this gastric sleeve. Less common procedure, we have Magen-Strauss and Mill procedure, vertical band gastroplasty, duodenal switch with bilo-pancreatic diversion, and combined procedure. Magen-Strauss and Mill procedure. It is older procedure and now no longer frequently performed since the advent of a newer technique described above. The Magen-Strauss or street of the stomach is a narrow gastric tube created from the lesser curvature by stapling from the antrum to the fundus. And although the fundus and the greater curvature remain in situ, they are functionally excluded. As we see here, we have the Magen-Strauss, and this is the street, and this is the esophagus, and this is the lesser curvature, and there is a stable, and this is the mill. And the food it is coming from the esophagus to the gastric tube here, and going to the mill from the antrum to the duodenum. And here we see this is excluded stomach. Here, this is the X-ray. We have the gastric tube. This is the Magen-Strauss, and this is here the excluded stomach, and this is the antrum. Vertical band gastroplasty. It is similar to Magen-Strauss and Miller procedure. The vertical band gastroplasty is a purely restrictive procedure that has been superseded by a newer technique, and there is stable line partition of the stomach to create a small gastric pouch in the lesser curvature, and a circular window is made the distal end of the stable line, and synthetic band or mesh is wrapped around the distal end of the gastric pouch, producing a stoma into remainder of the stomach. As we see here, this is the vertical banded gastroplasty, and it is similar to Magen-Strauss and Miller procedure, but in addition, there is a synthetic band placed around the gastric tube to augment restriction. And these here the stables. Duodenal switch with the bilo-pancreatic diversion. The duodenum switch is usually performed in conjunction with the sleeve gastrectomy to produce both restrictive and malabsorptive effect. Following the sleeve gastrectomy, the duodenum is resected and the distal small bowel anastomosed on the disconnected duodenum. The remainder of the small bowel is re-anastomosed distally. This produces about 150 centimeter Roxan limb and about 100 centimeter common channel shorter than Roxan Y procedure. This is usually reserved for sober obese patients and performed in a very limited number of centers. As we see here, this is the duodenal switch with bilo-pancreatic diversion, and we have the sleeve gastrectomy, and this is resected, and we have the gastric pouch, gastric tube, and here we have duodenal enteric anastomosis, and we have the pancreatobiliary limb, and we have this is the Rox lobe, and we have the jejunal anastomosis. And this procedure is often combined with the sleeve gastrectomy, and it is a restrictive component and malabsorptive procedure. Thank you very much for listening and hoping to see you soon in another talks discussing the detailed procedure of each bariatric surgery and its complication.